Hi everyone, this is Sanori from The Light Drive, and I am here with Dr. Shabbir Akbarally for Breast Cancer Awareness Month this October. We are going to be talking about breast cancer awareness, the symptoms and testing. Hi Dr. Shabbir Akbarally. How are you today?
Good, thank you.
Okay.
Thank you.
So why don't we tell our audience a little bit about yourself, Dr. Akbarally?
Yes, sure. I'm a general practitioner. I have been working in Sri Lanka now for almost 20 years, and as a GP, I see quite a few cases of breast cancer, those of women who are having it at the moment, and also women who've had it and post-treatment. But more than that, I see a lot of women who come to me asking for breast screening. So that would be my main association with breast cancer.
So let's go back to the basics when it comes to breast cancer. What is breast cancer and how common is it?
Yes. Yeah, breast cancer basically is a malignancy that occurs in the glandular tissue of the breast. And if not detected or not treated, it can grow both in the breast tissue, and in the later stages it can spread to what we call the lymph glands, which are in the armpit. And in the later stages, it can actually spread to other organs such as the liver, the lung, bone, and because of this, we see lots of people with breast cancer both in the private clinics that are there as well as the government sector. Now you asked me how common is it?
Yeah.
Breast cancer is the most common cancer amongst women, not just in Sri Lanka, but all over the world. And because it's so common, and because there is effective screening and treatment, we should take it very seriously.
Now, when it comes to cancer, breast cancer, any sort of cancer, there's always all these myths of what causes it. But what actually causes breast cancer?
Yeah, a lot of the causes we don't know, but there are quite a few that we do know. For example, if you've had a first-degree relative like a daughter, a mother or a sister with breast cancer, then your risk of getting it is higher. Certain genes make your risk much, much higher. These are non-modifiable risk factors. There are also modifiable risk factors for breast cancer. For example, obesity is one. Alcohol drinking is another, and the more alcohol you consume, the higher chance of breast cancer, but the actual percentage increase is not much, but there is a slight increase in incidence with these two things. Also, if you had a lot of radiation to the chest, that puts you at a high risk of breast cancer.
I had a question based on what you said, right? Like alcohol and obesity and all cause breast cancer. Now, like you said earlier, it's more common in women, but do men get it too?
Yes, men absolutely can get it. It's very rare, but they can get it, and it should be treated seriously, just like you treat a woman with breast cancer.
That's interesting, because I don't think it's well known that men can get it.
Absolutely right.
Now, when it comes to breast cancer, what's the initial symptoms of it?
Yes, so the commonest symptom of breast cancer is a lump, okay? And it's usually a lump within the breast tissue. And there are other symptoms, of course. For example, changes in the nipple, changes in the skin, pain, you can sometimes get a discharge. But to answer the question, the most important symptom is a lump.
Now, how is breast cancer diagnosed?
Yes, so if you have a lump, you have to go to your doctor. It's very important, and you have to get the doctor to examine you, and certain tests will be done. They will do what's called a diagnostic mammogram as opposed to a screening mammogram. They'll do an ultrasound just to delineate the actual lump, and that is followed by taking some cells from the actual lump, either what we call a needle test or a proper biopsy where a small amount of tissue is taken from the lump, sent to the pathologist, and the pathologist tells us whether it is malignant, i.e. a cancer, or whether it's benign, i.e. something harmless.
All right, and what are the stages of it?
Of the cancer?
Of the cancer,
yeah.
yes.
So when you say stage, you're referring to how much it has spread. Obviously, the earlier stages are when you have a small lump in the breast that's detected early and that hasn't spread. As the breast cancer grows, what tends to happen is you get growth in the lump in the breast, as well as in the later stages, the breast cancer can move into the lymph glands, which are under the armpit.
Okay.
And the later stage is when it spreads to the other parts of the body. For example, the lung, bone, brain, and so on. That's what is commonly referred to as the fourth stage.
Interesting. I want to go back to the previous question where you spoke about whether the lump is malignant or benign. If it's benign, do we as women have to do anything about it, or can it just be left alone?
Yeah, good question. Most surgeons would recommend removing it because the procedure is, it's a very small procedure to remove a benign breast lump. For example, you have the so-called breast mouse, which is a completely benign lump in the breast, and generally these are removed.
Okay, so it's an easy procedure, relatively.
That is, yes. It's easier, yes.
Okay, that's good to know. And that's reassuring to know as well.
And even there are a lot of lumps. It's important to know there are a lot of lumps which are not cancer. Just because a woman feels a lump, they don't need to get all anxious that they could be having cancer, because it may well be a benign lump.
So what are the treatments when it comes to breast cancer?
Yes, so the treatments basically fall into three categories. One is surgery, two is radiotherapy, where ionizing radiation is delivered to the tumor from outside, and this kills the cancer cells. And the third modality is what we call chemotherapy, where drugs are given either by injection or through the mouth to kill the cancer cells. So depending on the type of tumor, the stage of the tumor, the age of the patient, the surgeon and the oncologist will decide which treatment is best and which of the three to use.
Does the patient have a choice when it comes to it, or is it based off the doctor's advice?
Yeah, or it must be based on the doctor's advice, because breast cancer management is a highly specialized area, and there are doctors and surgeons who only specialize in breast disease, and they are very skilled and they are very knowledgeable about exactly what treatment will suit which patient. So you must take your advice from the specialist breast surgeon rather than decide what you want.
Okay. That's a very interesting thing. There's something I want to ask you. Now, when it comes to patients taking advice, sometimes hearing bad news always we give into fear, right? So do you advise patients to get a second or third opinion just to reassure themselves, or?
Almost certainly not. The surgeons that I refer my patients to are very good. They are very skilled, and a lot of the time it's quite apparent, after all the investigations have been done, it's quite apparent what course of treatment is necessary. And just sending the patient from one surgeon to the other probably will cause more confusion. Patients do that, and I get very angry, because what they do is they don't go, the second opinion that they go to is not a breast surgeon.
Dr. Akbarally, now when a patient is diagnosed as they have breast cancer, what's the prognosis and the outlook?
Yeah, so the prognosis, by prognosis what we mean is the outcome. It depends on the stage, it depends on lots of things, but the stage is very important. If someone has a very low stage cancer, say a small cancer in the breast which has not spread anywhere, the outcome is excellent. Okay, it's excellent, and the patient might only need surgery, and that also not a mastectomy where they remove the whole breast. These days they do breast conserving surgery. If the tumor is large, or if it has spread to the lymph nodes, more extensive surgery is needed, and so the outlook becomes less. The outlook becomes worse, obviously. And Unfortunately, if a patient is in the what we call the fourth stage of breast cancer, where the cancer has spread to the liver or the lung, then the possibility of cure is really not there. But there is extremely effective treatment for these patients as well to shrink the tumor and to give the patient a good quality of life for quite some time.
When it comes to treatments where you said, they might have to get breast conservation or a mastectomy or any such thing, do patients get, do they get some emotional and mental support with that too?
I'm not sure in Sri Lanka exactly how much of that they do get. Of course, if they come to me, then I do what I can. In Western countries, like for example Australia, where I trained, those services are much more available than here. But you're right. I mean, this is a very important aspect as well.
Absolutely, because a woman or a man, whoever gets it, they go through so much physical changes to their body, and like you said, the worse the stage is, I guess emotional and mental support would be much needed. Now let's get to the meat of the matter.
Yes.
Screening for breast cancer.
Yes.
So what is your opinion on it?
I really want to spend most time on screening. Firstly, what is screening? Okay, screening basically is trying to diagnose the disease before the symptoms have appeared. Okay, so basically when you screen people, you're screening healthy people. And why screening? The reason to screen is that if you find a disease at a very early stage, the chance of cure is obviously higher, right, than if you detected the disease later. So screening saves lives. Okay. Now screening, we're going to talk about screening for breast cancer, but screening modalities are there for many diseases. For example, you can test for microscopic amounts of blood in the stool to screen for colon cancer, that is cancer of the bowel. You can screen for glaucoma. You can screen for example, when you do a cholesterol test, when you're completely normal, you do a cholesterol test. That's actually a screening test to see whether you have high cholesterol. And of course, another very important test which women must do is what's called a Pap Smear. Now that's a screening test because the patient is normal, there are no symptoms, and you do a Pap Smear and you can detect cervical cancer, that's cancer of the lower part of the womb. You can detect it very early and offer the patient a chance of cure. So this is why screening is important. It works. Now breast screening is extremely important. Breast screening saves lives, full stop, right? Unfortunately in Sri Lanka, we do not have the mammography services island-wide freely available to all women. Many reasons for that. One is expensive. Two, we don't have the mammography machines everywhere, in all the public hospitals. And three, which is interesting, is that we don't have enough female radiographers. Because you can imagine a radiographer taking a breast scan, a mammogram, has to deal with women, who are undressed. And so it is a policy that mammograms are only taken by female radiographers. So if you don't have female radiographers, the opportunity of, say, screening millions of women in Sri Lanka is very difficult. But like say in Australia, all women between the ages of 50 to 74 are offered free 2-yearly breast screening by mammogram and ultrasound. And every woman in Australia is invited to do that and has access to it. So Sri Lanka being a low resource country, we have to rely on other screening methods. Breast self-examination is one such method. It's no substitute for mammography, but a lot of women find their breast cancers by doing self-examination. Okay, so what is breast self-examination? I'm sure you've
yes, we've been We call it the Touch Look Check campaign,
Yes.
which is what we are running on air right now.
But basically, it's you use the pulps, the pulps of your fingers to feel the 4 quadrants of the breast, looking for lumps. That's the main thing. And then you examine the armpit as well to see if there are any lymph glands that are swollen. And ideally, this should be done lying down, because when you lie down, the breast tends to spread. You can even do it in the shower, because when you have lather on your fingers and breast skin, the fingers tend to move easily. So, there are lots of other aspects to this which I'm not going to go into, but this is very important in Sri Lanka for women who do not have access or who cannot go for regular mammography. Okay, it's very important, because this is the only thing they'll have. And the advantage of breast self-examination is that it's free, it's painless, it's easily done. The disadvantage is that it's not as effective a screening modality as mammography and ultrasound.
So doctor, what is the age limit at which point a woman can go and get a mammography done?
Okay, this is a very important thing, and a lot of people don't know. I have had young women aged 25 going and getting a mammogram, which is completely crazy, because for many reasons, because if you're very young, the chance of actually detecting a breast cancer at the age of 25 is infinitesimal, extremely small.
And what about ultrasounds? If they were younger, is ultrasounds more safer?
So I'll just qualify one thing. In Sri Lanka, I have read I think it's the Breast Cancer Council recommendation, where they have mentioned that in Sri Lanka, mammography should be offered to those who can afford it or those who want it between the ages of 50 and 69 every 2 years. So it's very similar. So to go to ultrasound scans are much better if the woman is younger, say in their 30s. But as the woman gets older, because there's more fatty tissue in the breast, mammograms become more important. And if there's any query, I can leave my email or whatever. You can certainly write to me. Just screening in general, it's very, very important that the screening test you do for whichever disease is done at the correct age. Screening you should ask your doctor, if you want to screen for something, you should ask your doctor, should I screen for this at my age?
Talking about screening, now in one of your earlier answers you said the risk of breast cancer or any cancer increases when it's hereditary.
Yes.
Now let's say someone in your immediate family had breast cancer. Now as a child of that particular person, at what age do you need to start checking yourself for breast cancer?
Yeah, good question, isn't it? Yeah. For breast cancer, it is all, all the recommendations are there, right? I didn't talk when I spoke to you, I told you that women in general, all women need mammograms from 50 to 74 every 2 years. Okay, this is for all women, but if you have a strong family history of breast cancer, a really strong family history, obviously there'll be changes. You'll probably get genetic counseling, you'll probably have screening. Screening will start at an earlier age, at an earlier age, maybe more frequent. So to answer your question, even if you have, say a first degree relative, say a mother who had breast cancer and it's below 50, right, not above 50. If it's below 50, then you're at a high risk. So you should probably be more vigilant.
And that was Dr. Shabbir Akbarally over here with us for Breast Cancer Awareness Month this October. We'll be adding his contact details, so if you have any questions from him, you can always get in touch with him. Thank you, Doctor, for being with us over here.
Thank you for asking me to come.
Sri Lanka Insurance Motor Plus, driven by you.